Good morning, everyone. Yes. Firstly, one small little correction, Madam Mukta. Because all of you have come to my home, our place, AMTZ, I am not a guest, I am your chief host. So as a host, my privilege to have all of you here to celebrate this important Patient Safety Day of the country. My grateful regards to Madam Dr. Inge, who has come from Copenhagen. My senior colleagues, Dr. Vijay Agrawal, Colonel Singh, the youngest soldier in India, Colonel S.S. Singh, Captain Baban Rai, and of course the voice of consumer, Professor Bijon Mishra ji. I am not going to take much time because we are running 12 minutes late, and I'll try to compensate as much as I can. You see, healthcare, as you know, is one of the most complicated professions on earth. Aircraft and the flying is also a very complicated profession on earth. Not every profession is complicated and can have similar adverse. Why do we discuss about safety? Because of its potential to be harmful. Not every profession can be harmful. For example, stitching a shirt. Yes, you can go wrong. But what can it do to you except wasting little money and time? Perhaps nothing. Lights. If one of these lights don't work, what can go wrong? A bit of inconvenience. Imagine if an operation theater light goes off. What can happen? A very catastrophic outcome for the patient. Same light. Operation theater light is this light with multiple dome, color filter, temperature filter, shadowless. It has its characteristics, but the same technology. It's light. But this light can have inconvenience. That light can cause death. And therefore, tools may be same, but its application makes it very critical or casual. An healthcare professional is a very critical use of tools technologies. In a healthcare setting, what do we have? We have pharmaceutical products, so we have drug safety. Yesterday and day before, 2 days, we have the National Pharmacovigilance program here for the national centers. We discussed the patient safety from a pharmaceutical perspective. Then we have medical devices safety so that your medical equipment works well. That's called Materiovigilance, where we ensure that the devices are maintained, calibrated, kept in good quality for good use. Then we have the skills. Skill of doing a great job by being a good professional. That skill could be a CSSD operator, it could be a surgeon. It could be a receptionist, it could be a barcode reader, it could be an anesthesiologist, it could be a gynecologist, orthopedician, but you need to do your good job, and that comes after years and years and years of training under good teachers like Dr. Nandini. And then you actually become a good professional. But imagine if you have a good medicine, a good machine, a good professional, but there is no good practice. Then all three becomes risky. Good practice comes through empirical research, establishing facts, evidence, and then creating that evidence into a practice. And that practice requires you to be humble and strict. Humble because by itself it doesn't add any tangible value, and strict because if not followed, it will cause negative impact. So practice, it comes with discipline, protocols. And therefore, this day today, thanks to all of you, is a day that brings all four dimensions together. The drugs, the devices, the training, and the practice, which makes our healthcare better, safer, more effective. Now, my association with this has been fairly new. I am a hospital administrator. My colleagues from my past hospital, the Satsa Institute team is also here. So as a hospital administrator, my association with CSSD has been to use it. My association with ISHACON started with this wonderful team of Mukta, Madam Mukta, Dr. Nandini, Captain Baban Rai. When last year we inaugurated this in New Delhi. And then we realized that India does not have an academy to train CSSD professionals. Surprising. All the people here are trained on the job. There is no course in India to teach CSSD best practices to people who are passionate and knowledgeable and want to go ahead in that career. So what we did, AMTZ is a very unique place. Unique place because here we don't pass on the buck. We identify a problem, we solve the problem. We don't say, I have written to government, it is not happening. I have asked the organizations to come, they are not coming. I have shared with professionals and they are not listening. So we don't pass on the buck. So what we did, we created India's first academy for sterilization technology, giving respect, dignity, and knowledge to this sector. And the Academy of Sterilization Technology today operates with headquarters in this campus under the able leadership of its director, Mr. Rangarajan, who carried forward the mission of this academy with sincerity. But this academy is only a professional body, which means if you get trained in this academy or you encourage others to get trained in this academy, this professional body will give you knowledge. With knowledge must come recognition. Why is today an expert like Dr. Inge here? It's the knowledge and the work of the Danish Society for Patient Safety, which is recognized, remembered, and we invite her to share her wisdom. Recognition must accompany knowledge. Recognition is the job of the government. And therefore, I have a surprise gift for the governing body of the academy. A month ago, 3 weeks ago, we made a presentation to the Secretary, Government of India, Ministry of Skill Development, for recognizing many job roles in India that are not recognized. For example, oxygen technician. Right? There is no recognition. Somebody who operates the oxygen plant in the hospital is not recognized. It's not a job role. And therefore, in our country, we have something called National Skill Qualification Register. Once a job role is included in the National Skill Qualification Register, recognized by NCVVT, the National Council for Vocational Trainings, it becomes an official job role for the country as a profession. So you not only get trained, you get recognized, accredited, and you are a certified professional. And there are more than 200 job roles associated with healthcare that are yet to be recognized. And the happy and good news is, sterilization has been included as a national job role by the Ministry of Skill Development. Which means we have a society, we have an academy, we have experts, we have future generations to come. And you are lucky because your work, your effort, your knowledge, your training is now recognized by AMTZ, which has become an awarding body for job roles in India. That is 3 weeks ago. And therefore, let us celebrate, because the young professionals who are here, you may not have seen the hardship that seniors in the sector have seen. They have given their life for the work, for the promotion of sterilization, patient safety, infection control. They have given their life to promote, safeguard, and have it penetrate in healthcare organizations. We have captains like Dr. Vijay Agarwal that looks at accredited healthcare organizations. These accredited healthcare organizations are audited for infection control. And the consortium works under his able leadership. All of them seek your knowledge. But if your knowledge does not have recognition, then the acceptance will be low. Today, 1st March 2026, after this national meeting, go back in the evening knowing that today onwards, your job role, your profession, your practice of sterilization, CSSD, infection control is a nationally recognized job role. Thank you very much.